Welcome to Purr Wag, Berkshire Humane Society's local cable TV access show. My name is John Peralt and I'm your host. We have a great show here today. Today we're going to be talking about wellness exams for your dog and cat. And my guest today is Dr. Michelle Looney from Pittsfield Veterinary Hospital. Welcome.
Thank you, John.
And I guess we'll get right into it. Why is it so important to have your dog or cat have a wellness exam, and how often should they be done?
It's so important to help us to maintain health. It's about well care. We like to try to have a chance to pick up on problems when they're small and it's early. If we can pick up on them earlier, it's easier to treat them. It's easier on the animals, it's easier on the owners, and it's easier on the pocketbook. So we like to try to monitor the health of the animals, and if we can keep an eye on ongoing medical issues and keep them in check, and talk about well living, so good exercise and diet and grooming, and parasite prevention is a big topic that we go over during well visits. Some parasites are contagious to people. They're zoonotic, so not only can they cause illness in animals, but they can cause illness in people, especially young children, because they have more of a tendency to put their hands in their mouths or be on the floor. So during their well visit, we like people to bring in a fecal sample, and we do a heartworm test. So we also we go over the things like that.
Okay. So what's involved in a well? What are you really looking at when you get that animal in your office, up on the table?
Yep.
How do you perform one of these wellness exams?
Well, the first part is actually talking to the owner. I like to start the exam on the animal by just doing a visual exam. I watch them and see if they're acting appropriate, if they're aware, if they're alert, if they're moving normally and breathing comfortably while I'm talking to the owner. So I usually open up by having some general questions just to get an idea of how people feel things are going at home, and let them talk a little bit and tell me overall how they think the health of their animal, the behavior of their animal is going at home. And after they get through that and I'm observing the animal while we talk, I ask some specific questions. We usually go through a battery of specific questions, such as, is there any coughing, sneezing, vomiting, diarrhea, change in water consumption, what exactly are you feeding and how much and how often, are you giving any medications, exactly how much and how often. Sometimes we have in the record what we think is being given, and it may be a little different, any supplements. And then after we talked and got things out, answered any questions that I can before the exam, we'll put the animal on the table, and we try to do a thorough exam, looking at the animal from the tip of their nose to the tip of their tail. And every veterinarian has their own way of going about it systematically, so we don't leave anything out. So we usually look at the eyes, ears, nose, and throat, and take a good look in their mouth if the animal lets us, depending on their personality, if they allow us to get a good look. And I like to show the owners their teeth and talk about oral health and oral care. And then we use special instruments to look in their eyes and their ears. We palpate their lymph nodes. And I try to talk to people as I'm doing the exam to give them feedback and what we're finding. Take a good listen to their heart and lungs and palpate their abdomen. And then we go through the musculoskeletal system and take a feel of their limbs and move their joints through a range of motion and see if they're comfortable, if they have any pain or decreased range of motion, if they have normal muscling. And then I look at their skin and look under their tail, look at their feet, and give people feedback on what we're finding, and maybe make some recommendations about how to keep this animal healthy.
What I'm really hearing, though, too, is that what the people bring to the table, what they tell you, because you're in that room with them 15 minutes maybe, and so your initial conversations are so important. So everybody out there should be aware of a lot of the questions you're going to be asking, and really pay close attention to their canine or their feline prior to coming and seeing you, because
that helps a lot.
That's got to help a lot as well. You know, let's talk about some internal parasites. I know you talk about some zoonotic situations, and what are some of the internal parasites that we're hopefully going to pick up during that wellness exam?
So we like clients to bring in a fecal sample if they can get one before they come in. So we start that running, so we'll have the results of that by the end of the visit, and we're checking for intestinal parasites. The most common intestinal parasites we see are hookworms, roundworms, whipworms, and tapeworms. They can also get coccidia or giardia. The way they pick those up, two of them, hooks and rounds, they can actually pick up from their moms, from nursing, or in utero if they're young animals. They can also pick them up from the environment. Parasites that are shed in the feces actually leave the stool and go off into the grass, and if animals just nose around in the soil or the grass, they're able to pick up worms that way. So it's very easy for them to acquire parasites. That's why we like to look once a year and also try to get people to use monthly heartworm pills, because not only does it prevent heartworm, but there's a monthly intestinal dewormer in that medication. And we also test for heartworm in the visit, which is another internal parasite that's spread by mosquitoes.
Right.
So the mosquito, if it's infected with heartworm, will inject the heartworm larvae into the skin. It takes about 6 months, and it travels through the tissue, and then it actually develops into a real long worm that lives in the heart, and it can cause lung and heart disease if there's a large number of them.
Because presently we have a dog in our shelter, a Doberman, that's going through heartworm treatment because he came in, he was positive, so he's taking the treatment as well. How often are you seeing heartworm?
We're seeing it more than we used to. We've had a few cases over the past year of heartworm-positive dogs that have always lived in this area. We certainly see it in those animals that come up from the south, but we are seeing it a little bit more in animals that live here too. It's so easy to prevent with a monthly heartworm pill, but treating is a little bit more dangerous because as those worms die, they can form emboli that can lodge in the lungs. So it's much easier to prevent than to treat.
Monthly prevention, pill given once a month, not only take care of heartworm prevention, but will also take care of a lot of those other intestinal parasites that you're talking about as well. The last couple of years, we've seen lots of flea and tick issues, and I know we were talking the other day about that last year was a bad year, and I think with all the snow and rain, what are you predicting for this year, and you know, the solution to this?
I think fleas and ticks are always going to be a problem in this area. Ticks are certainly every year getting worse. When I was a kid and lived around here, we really didn't have ticks, and now we see them all the time. The problem with ticks is they bring disease. There are several tick-borne diseases that our patients can get, and the patients are almost sentinels for the people. People can't get tick-borne disease from their animals, but if you're out hiking with your dog and your dog gets ticks, then you're certainly susceptible to those same ticks that your animals are getting. So we do recommend monthly flea and tick preventive. There's so many choices. There's a lot of different options, but something to prevent fleas and ticks, and then do tick checks every night during the warmer months, and we even pull ticks off in the winter when we have a warm snap and the grass shows through. Maybe not so much this winter, but other winters when we've had more grass, we will pull ticks in the winter. So we like people to keep that going year-round. And Lyme disease is, you know, the most common tick-borne disease that we have, but there are other tick-borne diseases. And fleas are just easier to prevent than to get rid of. But
and once you have them, they're there.
It's hard to, you have to treat the environment as well as the animal. So monthly flea and tick prevention.
And it's topical now.
It's a topical, yep. You just put it on a cat way up behind the back of their ears because they are so flexible they can lick it off the back of their neck. So up high, and in dogs it goes multiple areas along their back.
If we can just step back a little bit, even from our shelter, and every dog that comes in we test for heartworm and Lyme, and we're seeing more and more Lyme. Treatment for it, how long does it, we see dogs that test positive sometimes for a couple of years. Lyme
disease is a bacteria that is, the animal almost never clears it. It's always going to be in their body, but the test can actually go negative after treating them because the number of organisms in their body can go way down. Many animals never develop disease from Lyme disease. Their immune system keeps it in check, and they never develop symptoms. So there's a big debate about whether or not to treat Lyme-positive dogs that are not symptomatic. The disease is usually, the signs are joint pain, lethargy, fevers, but in uncommon cases, you can actually have a fatal kidney disease, and they can sometimes have a neurologic component. So we talked with people about whether or not to treat the animals. We usually do treat animals that is their first time infection, they have a strong positive, and then we like to monitor them once a year with the 40X test for heartworm and Lyme. And we like to get a urine sample twice a year to measure for protein, because if we can catch the kidney disease that could be caused by Lyme early, we can try to stave it off and support the kidneys as much as we can.
So can you end up with the kidney issues without being symptomatic?
Yeah, because symptoms can be pretty mild sometimes in some animals. They may have just a little stiffness. It may not be, you know, picked up by the owner. Yeah, you could have the kidney disease later on when they have very mild symptoms for a short period of time of the little fevers and joint pain, lethargy.
I know my dogs have been there, have had that. Now there's a vaccine for Lyme as well, right?
There is, yes. It's a pretty good vaccine. It's not as effective as rabies or distemper, which are nearly 100% preventive of those diseases. Lyme is probably 75–80% preventive, but it is one more way to try to prevent the disease. And again, we tailor vaccine protocols to the individual. We like to have a conversation with people about what the exposure rate this animal has to ticks. If they're hiking and they're out all the time and they do get ticks, that might be right for that animal to get yearly Lyme vaccines. If you have a dog that hardly ever goes outside, they're litter box trained, they're a little tiny dog, that dog probably doesn't need a yearly Lyme vaccine. The vaccine has an interesting way of working. It actually vaccinates the tick. So the dog produces antibodies to Lyme disease, and when the tick ingests blood, it prevents the Lyme bacteria from leaving the tick and going back into the dog.
Wow.
So that's how it works.
You know, we started talking about vaccines a little bit. I know in the sheltering community 10, 12 years ago, there was a lot of push to go towards a 3-year vaccine. And I've been there longer than 12 years, I hate to say. But one of the issues that, you know, in the sheltering world, they used to always tell us, if you worked in a shelter, is to vaccinate your pets multiple times per year. So we were in the sheltering world, employees, because we could bring, who knows, whatever home to our pets and seeing whatever was coming in. There were many years we were vaccinating twice a year.
Wow.
So we went from vaccinating twice a year to people starting to talk about and drug companies started talking about, you know what, maybe they, after a certain age, they can get a 3-year vaccine compared to a 1-year. And I know there's some veterinary clinics that say, well, maybe we shouldn't be giving them a vaccine. Maybe we should be checking their titer. How does all that work?
The first thing I'd like to say is about rabies. We do have rabies in this environment. We've seen it in the paper. So I think that's the first vaccine we go over is, it's a terrible disease. It's 100% fatal in dogs and people. It's very preventable.
And it is required by law.
It's required by law,
that's a must.
right. So they can get their first rabies vaccine anytime after 3 months of age. And then the one after that, as long as it's 9 to 12 months from the first one, and it's not 12 months in one day, is good for 3 years, depending on the product. There is a 3-year rabies vaccine once they've had that first one, and the second one is good for 3 years. And everyone the rest of their life is good for 3 years. That is a little different in cats. Cats can rarely, and it also depends a little bit on genetics, be prone to developing a type of tumor due to vaccines. So there is also an option to do a non-adjuvanted yearly rabies vaccine. So that's a debate as to should we vaccinate them more frequently and cause less inflammation or less frequently. So right now we are recommending every 3rd year in cats and dogs to try to prevent that terrible disease. So rabies is the first one.